So it's my pleasure today to introduce our speaker, Natasha Jivan. Natasha is both a registered nurse and clinical psychologist with nearly 2 decades of experience supporting individuals facing serious diagnosis, including cancer. Drawing from her professional background and personal insight, she brings warmth, empathy, and practical guidance to this important topic: how to navigate difficult conversations during a cancer journey. Please feel free to post any questions or comments in the chat as we go along, and I'll share them with Natasha at the end during the Q&A. So that is everything from me. Just make sure that we are recording and we're ready to go. Over to you, Natasha. Thank you.
Thank you so much, Shara. Thank you for having me. I'm really delighted to be with you this evening here where I am, this morning where you are. So yes, today we are going to be talking about navigating difficult conversations, a tricky topic that a lot of people will have different reactions to. So I'm looking forward to diving into this with you today. I'm going to share my screen so that I can share my slides, and you will still get to see me. Yeah. Okay. Lovely. So hopefully you can see that okay?
Yeah.
Great. So yes, today, as Shara said, and thank you for the kind invitation, Shara, to come and present to you all today. We will be discussing difficult conversations and how to navigate those. So I just want to do an acknowledgement to country. So where I am in Australia, it is tradition when people meet together that we do an acknowledgement to country. So this is where we acknowledge the traditional custodians of the land where we work, play, and live. So here where I am on the Sunshine Coast in Queensland, that is the Gubbi Gubbi people. So we acknowledge their spiritual and cultural belonging and recognize their continuing connection to land, waters, and culture. We pay our respects to their elders, past, present, and emerging. So just a little bit about me. So as Shara said, my name is Natasha Jivan. I'm a clinical psychologist and I'm a registered nurse, and I'm on the Sunshine Coast in Queensland, which has not been very sunny. You would think we were in England with the weather we've been having, because it's been torrential with rain since Christmas time. So I own and I run a group private practice, and I work a lot with clients in the palliative care, bereavement, and oncology space. And my passion for working in this area is the fact that my own family, or I have been touched by cancer in my own family, with both of my parents having had cancer. So this has ignited my passion to give back to this field, because I can see that there is so much need for support and so much wonderful work that can be done in the area. So I'm looking forward to talking to you about this tonight. Now, why is that not? There we go. So just to go over what we're going to be covering this evening. So our objectives for this evening is to obviously gain an understanding of why challenging and difficult conversations are important, just to set the scene a little bit. Then we're going to explore when this is particularly hard for people and some of the reasons as to why this is hard. Obviously, this is a topic that sometimes people struggle with and want to turn away from. So we will explore why that's our inclination to do that. I'll also then go into understanding some of the common unhelpful communication patterns, because inevitably, as human beings, we will have existed in our own families where we will have been taught certain ways of managing these types of conversations. And so sometimes it is important to go over some of those unhelpful communication patterns so we can think about whether or not they might apply to us. Then I'm going to offer a couple of frameworks and some skills that you can then walk away from this and you can practice and play around with. And I just want to give you a little bit of guidance in terms of, reflection on the topic that we've discussed tonight, and then also some resources. So the other thing too, sorry, I should just say there, which is what Shara has said also, I want to make sure that this is interactive. So I know that most of you are joining us and you have your cameras off, and that's completely okay. But if you do have any questions, please feel free to pop those in the chat and ask at any time. And I can answer those either along the way or at the end, as Shara said. So I just wanted to have a little bit of a play around, because obviously this topic can be a little bit difficult for people, and I do have a bit of a playful side. So I wanted to talk about a couple of cliches that sometimes come up when, people will often say to me, but do I have to talk about this? It's so much easier to just stick my head in the sand, right? Or, not to talk about the elephant in the room. However, what we're going to discuss tonight is the fact that sometimes these traditional ways of coping, which is to avoid and not talk about these things, often comes at a cost. So I'm hopefully here to inspire you and encourage you to have these difficult conversations, because there is so much richness that can come out of this. And it turns out to probably be a lot easier in the long run than using these two strategies. So tonight, one of the people that you will hear me quote a lot is the lovely Brene Brown. And if you haven't come across Brene Brown, I highly encourage you to have a look. She has a very famous TED Talk, which she did about 12 years ago, which kind of set the stage for her a little bit. But Brene Brown is an academic, an author, and a researcher. So she's a Texan lady who is a social worker. And she has done a lot of research into vulnerability. And certainly for me, she has been my inspiration and my guide in terms of learning how to navigate these conversations. So if you don't know any of Brene's work, have a look. She's got podcasts, books, TED Talks. But this quote that is very famous from Brene pretty much sets the scene for our topic tonight. And she says, there is no courage without vulnerability. Courage requires the willingness to lean into uncertainty, risk, and emotional exposure. So the idea is that, it is going to take courage to sometimes have these conversations. And these conversations are going to be a little bit risky, but the benefit of it is, as we will go on to talk about together, is deeper connection, is having your needs met. And there's so many benefits in being able to do this. So I would just want to start with how we as, or I as a psychologist, or in psychology, how we look at or define difficult conversations. So difficult conversations are obviously a dialogue that addresses sensitive, controversial, or emotionally charged topics that potentially lead to conflict, discomfort, and disagreement. So the idea with this is setting the scene that typically a difficult conversation is that we're going to talk about something hard, that this is something that is going to potentially create discomfort, and we have to be willing to lean into that discomfort and know that it's potentially not going to be all rainbows and sunshine. These conversations require us to navigate complex social, emotional, and cognitive factors, demanding skills like empathy, active listening, and emotional intelligence. And I'm going to speak more to these skills a little bit later in the talk this evening. But this is really about the interpersonal exchange, because when we have a difficult conversation, there are other people involved in that process. We're not just doing that with ourselves. So this speaks to the complex interpersonal landscape that sometimes we have to enter. And therefore, we need to work out how to do this, right? We need to be able to have skills to make sure that the conversation goes well. And obviously, they often involve goals, competing goals, values or interests that can trigger deep emotional reactions, as well as our biases. So the thing is that we are going to go into that conversation and potentially are going to be triggered. We are going to have emotional reactions. We are going to have things come up for us, because what's happening is we're presenting to the other person what our perspective is, how we feel, or what our values are. And sometimes it can mean that people aren't on the same page about that. How we feel about something and how another person feels about something sometimes can be in conflict. And the whole purpose sometimes is being able to see if you can get on the same page. But as part of that process, it is going to trigger deep emotional reactions. So this next slide here, I'm just going to move this over a little bit. So Brene Brown talks about this idea of difficult conversations being a rumble, and I love her definition of this. She talks about a rumble as a discussion, a conversation, or a meeting that's defined by a commitment to lean into vulnerability. And when you're in there, it's to stay curious and to stay generous, to stick with the messy middle of the problem identification and solving, to take a break and circle back when necessary, to be fearless when owning our own parts. So this is the guidance that she gives us around how we can navigate a difficult conversation. And she talks a lot about vulnerability, which obviously, as human beings, often is counterintuitive to us. A lot of us as human beings, we don't like being vulnerable. If you think about the analogy of, of an animal like a dog or a cat. Now, a dog and a cat, they're only going to lie on their back and expose all their organs if they really, really trust you. And what happens if they get a fright is they're going to jump up really quickly, because that's what's going to protect them and allow them to engage in some sort of kind of defense. Now, obviously, as humans, we don't lie on our backs, but we don't like vulnerability. And often we do lots of things to protect us away from vulnerability. So the first thing that we have to be willing to do is to lean into that. As part of staying curious and generous, what she means by that is we've got to openly ask questions. We've got to be willing to dive into that space with that person and be very cautious about our own assumptions in that. She talks about sticking with the messy middle of the problem identification and solving, which sometimes means that it's going to be really uncomfortable, and there's going to take a period of time where, in order to problem solve, in order to work out what's going on, it is going to be really messy. So that means that sometimes in these conversations and, navigating difficult conversations will inevitably involve sometimes taking a break and actually allowing yourself to walk away, and to communicate that with the other person, and then to come back and be fearless when owning your own parts, which means showing up as you are. So I want to talk a little bit now about how this is relevant to the cancer journey. So as many of you know, the cancer journey really requires many conversations about diagnosis, about treatment, the multiple decisions that need to be made, about mortality, about emotions, thoughts, fears, and of course, quality of life. And so when many people, what I have seen in my own lived experience, or personal experience, sorry, and with my clients, is that many people then are thrown into this much quicker than perhaps what they feel ready for. So this requires a really steep learning curve into some of these things that I'm talking about tonight, because we aren't typically sort of taught this stuff. So it's a very quick crash course into these conversations. And as we navigate many of these conversations, what will happen is that the old patterns that we may have within ourselves, some of the patterns that we have within our families or what we've been taught, will start to show up. And some of these can be things like, wanting to actually avoid these conversations, wanting to people please and think about others more than ourselves. We might also think be trying to shut down our emotions rather than being able to talk about them, not knowing how to ask for help, and not knowing what we need. I think one of the other really difficult things that culturally, not just looking at our families of origin, but culturally, we really aren't supported or taught how to tolerate uncomfortable emotions. We might be defensive or we might deflect. Or one of the other things that commonly gets told is just to stay positive and be positive, perhaps because the other person might not want to talk about this. So I guess it's really important that we think about what are the costs of these old patterns, because inevitably, when we shut down emotions, when we don't talk about what we need, when we don't ask for help, when we people please, there will be consequences for this on us or on our loved ones if we are caring for someone. And I think the most pressing thing is that when we aren't able to have these difficult conversations and talk about these things, it leads to people not knowing how we feel. And then the flip side of that too is not knowing how others feel. So when we don't have these difficult conversations, there will become this sort of mirroring almost of avoidance or this lack of reciprocity around, hey, we can talk about this stuff. The other thing that it can lead to is unhealthy internalization. So what I mean by that is that we keep it inside, we go inwards, and we kind of leave it there. And when we internalize something and we move inwards, it can lead to something called rumination. And rumination is where we go around and around and around, sometimes in our heads. So rather than being open and honest with someone and sharing our thoughts and feelings, what it can lead to is our own experience of difficulty, which then causes isolation and sadness. I think another thing that can happen is resentment, where we can be frustrated or annoyed or unhappy with other people and what they're doing or saying or how they're behaving. And when we don't engage in these difficult conversations, it leads us to build resentment. And then obviously in people that have a diagnosis of cancer, it's well documented in the research that people can develop presentations such as depression and anxiety. So this is something that when we have a continued pattern that is not helpful for us or not healthy, then and particularly when we have a genetic predisposition to developing a mental health issue, it can lead to something like a depressive disorder or an anxiety disorder. The other really important thing to think about is that when we don't engage in these difficult conversations or talk to other people about our thoughts and our feelings, it may lead to our treating teams or, your loved ones' treating teams not completely knowing or understanding what you're feeling or what you're thinking. And as a result of that, something I commonly see is that treating teams then go on to make assumptions about people, and that sometimes those assumptions can impact treatment. I think that whilst thinking about navigating difficult conversations, we think about them a lot in the context of interpersonal relationships. So if you're the person affected by cancer, or if you have a loved one that is impacted by cancer. But I think the other really important thing to think about and talk about is these difficult conversations with your health professionals. Because sometimes health professionals will do and say things that won't feel okay for you. And so it is really important to also be navigating and having these conversations with treating teams and with health professionals, so that you can speak up and you can have a voice and people know how you're thinking and feeling. I guess the other major cost, which I've kind of already alluded to, is that it can cause a breakdown in relationships and emotional disconnection. The other thing that I think I come back to a lot with my clients and people that I talk to is what are your values and what is important to you? Because being able to navigate these difficult conversations whilst, like we're talking about, can be tricky and can be hard, it's really important that we learn how to live by our values and be true to ourselves. So if we aren't being open and honest and expressing ourselves and our needs, sometimes it means that it may lead you to navigate this journey in a way that's not aligned with who you are or who you want to be. And whilst there is significant stress and there's significant anxiety and trauma that can come from a cancer diagnosis or having a loved one navigating this, there can also be significant growth. And anchoring to your values and who you are and what you need and learning how to express that can actually help you to grow in some really healthy ways. So obviously, when we aren't expressing our needs and when we aren't having these conversations, the result is deeper disconnection. And that will potentially only embed further and further. And that's not what we want, right? So, of course, what is then the benefit of having difficult conversations? So the first thing, obviously, and you'll hear me say this phrase a lot, but it's about being seen and heard and having your needs met. As human beings, we have needs in life. We have them from when we're born. And I'm not just talking about physical needs of a roof over our head and food in our belly. And of course, all of those things are really important. But we have really important psychological and emotional needs that we need to have met. And when those needs aren't met, it really does impact us. So this is one of the core kind of takeaways that I want you to have from tonight, is that having these conversations will allow you to have your needs met. The other thing is it will help you to get the support that you need. And of course, not just the support that you need, but the support that you deserve, that everyone deserves who's navigating this journey. It truly does lead to deepening connection and preserving relationships. So I spoke earlier about, how sometimes as human beings, we don't like being vulnerable. It feels almost counterintuitive to be vulnerable. We often keep our cards close to our chest. We sometimes don't want other people to know because we make assumptions, or maybe we've had experiences in the past, whether it be in childhood, in other relationships, where people haven't, respected that or held that in a supportive, tender way. So sometimes we learn not to be vulnerable, or we get scared of being vulnerable. And I guess what I want to suggest tonight is that deepening your connection is one of the beautiful benefits of being vulnerable, that it can often bring you closer to people that you love and to people that are around you, and can really help to preserve and enhance relationships in a very positive way. The other benefit is learning to express yourself, to tolerate the discomfort of the messy middle, which then, of course, creates vulnerability, bravery, and courage. And I think that this also, speaks to our wider culture and sometimes our experiences in life, that we aren't encouraged to express ourselves. Sometimes, for whatever reasons, we think we have to hide our thoughts and feelings, or that people don't want to hear it, or potentially we might be worried about the impact that that might have on another person if we were to express ourselves. And of course, to tolerate the discomfort that comes with that. I hear lots of my clients talking about not wanting to have difficult conversations because they're worried about the discomfort, not just for themselves, but the discomfort for the other person as well. And one of the things that we have to really learn in life, and one of the things I probably do most as a psychologist, is to help people learn how to be with discomfort, how to tolerate that emotion. Because when you can tolerate that emotion, it really helps you to navigate life in a different way. But when we're constantly wanting to move away from uncomfortable emotions, it often means we're engaging in behaviors that aren't going to be particularly helpful for us. And of course, like I talked about before, the benefit of living by your values, which again, I talk to a lot of my clients about, which is value-centered living. What is important to you and how do you want to live your life? Because it allows you then to navigate these conversations differently. And when we put this all together, it will all in turn make small differences in navigating the cancer journey. And of course, the result is deeper connection. And that is what we are aiming for in being able to support people in our lives to be part of that conversation with us, to sit in that place that might feel really difficult and really unfamiliar. But when you work through it together, it helps you to have much, much, much deeper connection and more richer and meaningful relationships. So what I want to talk about now is some of those typical unhelpful communication patterns. So I'm actually drawing upon the work of the amazing Gottman Institute. If you haven't come across them, they are a really great resource when it comes to navigating relationships. They have done a lot of work in the couples space, and they have identified this thing that they call the four horsemen. And these are really well-researched predictors of things that will cause a relationship breakdown, especially when people are undergoing prolonged stress. So what I want to say as we're diving into this though too, I want to preface this section as well, because I don't want anyone to feel like guilty or ashamed. I want to say that we're all going to engage in this stuff from time to time. Okay, we are not Pollyanna. We're not, living in a world of rainbows and unicorns where all of our interactions are really healthy and really amazing, and that's okay. That would be unrealistic. So as we talk through this, I invite you to really very gently hold yourself and your inquiry around, yeah, is this something that sometimes I do? Do I have a tendency to engage in this behavior? Are there times that I can think about doing that? And I want you to do this in a really compassionate way for yourself. And if it does, trigger any uncomfortable emotions, then please take good care of yourself, whatever that looks like for you. So the first one is criticism, which we kind of all know about, right? So criticism in this context means that when somebody is attacking the character of somebody else. So instead of looking at the behavior of, or this person's engaging in this particular behavior or doing this particular thing that bothers me, we're kind of attacking the whole person. So an example of this is something like, oh, you're the worst support, you never help me. So this is where we might not be identifying the particular ways that the person isn't supporting us, but rather we're saying that they just are unsupportive. Another way of looking at this is saying you never take care of yourself and this is your fault. So the second of the four horsemen is contempt. So contempt is where someone might use sort of more mockery or sarcasm at somebody else, and might use this from kind of an air of superiority. So often there's a particular tone when there is contempt showing up in us. And it can be things like, wow, it must be so hard for you you to sit here while I go through treatment. Or someone saying, oh, stop being so dramatic, people have it worse. So it's really dismissing the other person's experience and kind of mocking the other person's experience as well. And it can also be using particular, like negative labels about people as well. Defensiveness, and this is something that's just really common. that I see as a communication pattern for a lot of people. And defensiveness is when we deny responsibility. So we're not willing to acknowledge that particular thing that the person's talking to us about, or where we're counter blaming. So rather than being able to take on feedback, we're kind of launching something back at the other person. And an example of this would be something like, well, you should know what to do. Or why are you mad at me? I'm just trying to help. So this is where sometimes we're not really taking on board what it is the person's saying to us or asking from us. And the final example is stonewalling. So stonewalling is the kind of the clues in the name, right? It's where you become a bit like a wall against the other person. And so this is where you might withdraw or kind of shut down, or just refusing to talk. And this is where people might disengage from the conversation altogether. So people who are conflict avoidant or who can tend to be sort of more passive aggressive, this can be something that people engage in by avoiding the conversation. I'm just not willing to even talk to you about this. So I'm going to turn away and I'm going to completely withdraw. So people that kind of walk away from the conversation without actually saying, hey, I need a break, or I'm getting really worked up, or I think this conversation's not going well. Can we take a time out? It's where people will actually just withdraw from the person. So there are some other unhelpful communication patterns that I thought was helpful to talk about. These aren't particularly part of the Gottman model, but so this is where sometimes we can, there are certain personality profiles, I think, that have a tendency to overly control situations or have like a fix-it mode. Both the person possibly who's undergoing the cancer journey, but I see this kind of commonly for loved ones and carers as well. And this is where, whenever I see someone that engages in controlling behaviors, often I know that there's some sort of anxiety underneath as well. So this might be things like taking over decisions or routines or taking over treatment plans, and the person saying, well, if I've just researched this and I just want you to follow this plan, and if we follow this plan, it'll be all okay. So where the person's just trying to be very solution focused and problem focused and kind of make it all better as a way of managing their own anxiety or feelings underneath. Another thing that kind of naturally will happen is catastrophizing out loud. And sometimes this is where people will amplify the worst case scenario. And of course, naturally, there are going to be times where people might feel like this. And this is where someone might say something like, oh, this will never end and there's just no hope. And that's often kind of driven by a thinking error, which again is driven by some sort of uncomfortable emotion. The other is hyper-rationalizing. So rationalizing is when we go to our intellectual brain. So sometimes when our emotional world feels too messy or uncomfortable or overwhelming, we want to go to rationalizing. And so this is avoiding the emotion by focusing only on data. So this is where someone might say something like, let's just stick to the facts. There's no point getting emotional. And I think the extreme example of this would be someone like Sheldon from The Big Bang, who would, really hyper rationalize things. Another thing that is a very kind of on-trend phrase at the moment, but I think it is really important when someone is navigating a difficult diagnosis or a really confronting diagnosis, and that is toxic positivity. And this is where I think we can all think of people in our lives that would just say, just focus on the positives and don't focus on the negatives. You just need to stay positive. And whilst, yes, absolutely, mindset is well researched in terms of, the impact on health. And at the same point in time, it is also okay to acknowledge the hard stuff. So this is something we also have to watch out for. Emotional dumping. So this is where we might be overwhelmed with emotions and not really sure what to do with them. And then we release that onto other people without any boundaries. An example of that would be something like, I'm sick of this, I'm sick of you, and can typically lead onto some really big, long kind of diatribe or, a lot of emotions that the person has been thinking and feeling and sitting with that they then kind of project and can place on the other person. And then the other one, which is also really common, and Freud would say that this was, what did he call it? It was the most developed or most intelligent form of psychological defense. And this is humor. So that's not to say that using humor throughout this journey and, having a good, being able to laugh at things isn't important, but this is when humor is used as deflection. So rather than being able to take something on or to sit with it, I think we again can think of all those people that use jokes or sarcasm to avoid vulnerability. So an example of that is someone maybe saying, I guess I'm getting a 2-for-1 boob job. It might feel like, it might be that person kind of joking, and it may be their humor. And it's not to say that that's wrong, but it's just, is it a form of deflection to move away from maybe the sadness or the vulnerability or the overwhelm that's going on for them? Again, this doesn't need to be perfect. We will all do some of these sometimes. And don't worry, if my husband was here, he would tell you that even as a psychologist, I do these things too, because we are all human. So yeah, it's not to say that if you're doing these things, you're bad in any way. It's about awareness. Any change that we make or any work that we're trying to do on ourselves or on relationships, awareness is 70% of the work. So it's about being able to look at these things and going, oh yeah, I actually do have a tendency to swing to these kind of couple of patterns. And if you have someone that you trust or someone that you love, or, a partner or a child or a friend, or then you might say, I went to this talk and what I noticed is, yeah, I have a tendency to kind of talk about, to use these types of unhelpful communication strategies, and I'm really working on it. So in terms of these unhelpful communication patterns, there are things that will impact on this for sure. Of course, as a psychologist, one of the things is our childhood patterns, and I'm not here to blame mums and dads. I am a mum myself. But it is about, in my work, what I say to all of my clients is most of the parents that I ever meet, they really are trying their best for their kids. I really can rarely think of any examples where that hasn't been the case for what I have seen. I know that it does happen, but most of our childhood patterns will impact how we then engage in conversations and in interpersonal relationships. So whether our parents were safe and secure, and in times of abuse or neglect, then no, that isn't a time where a parent is creating that environment. So that is going to have an impact on somebody's ability to have these conversations. But it's even just other patterns that we had with our parents, whether our parents were authoritarian, or what that attachment relationship was like. The other thing that comes up a lot is how we were taught to engage in these relationships in our families of origin. So how did mum and dad go about conflict, and what did we witness? Were they the sort of people that were like, oh no, we don't argue in front of the kids, and we do it behind closed doors, but maybe the kids would hear yelling anyway? Or maybe mum and dad were really dysregulated themselves and they would fight in front of a child, but yet the child didn't maybe get to see how mum and dad worked it out. Or how did mum and dad talk to me, and how did they communicate to me? Were they open in their communication? Were they respectful? Did they encourage a conversation between me and them? Or was I shut down? Was I not allowed to talk about my thoughts and feelings? Was I not allowed to ask to have my needs met? The other thing that is going to impact on this is, of course, stress levels and how we are feeling at the time. We often use what's called a SUD scale for different things in psychology. It's a subjective units of distress scale. And it's typically out of 0 out of 10 or 0 out of 100. So if you're at a stress level, say 0 out of 10, and you're at a stress level of 7 or 8, what that tells you is you actually haven't got much room to go until you hit the ceiling, right? So if you are functioning at a really high stress level, a difficult conversation really isn't going to go well. So that goes back to that awareness that I was talking about, checking in with yourself and going, okay, how am I feeling at the time? And it's maybe about not engaging in difficult conversations when your stress levels are really high, if you can avoid it. The other thing too is trauma will impact our ability to have these conversations. There's a really wonderful YouTube clip by a guy called, oh gosh, Dan Siegel, and he is an American psychiatrist and neuroscientist, I think he is. And he has this hand model of the brain that talks about how our limbic system, which is what he puts as the thumb, and then this is our frontal lobe, which is our thinking brain. When we get overwhelmed with emotion and when we go into fight, flight, freeze, which is controlled by the amygdala or the emotional brain or limbic system, we actually do a thing that he calls flipping our lid. So when we flip our lid, our thinking brain goes offline. So it means that we're not able to engage our thoughts in the way that we would like to. And it's kind of like when you go in and you have an argument with someone and you walk away and you think, oh, why didn't I say that? That's because you flipped your lid. But have a look at that. He does a far better job of me at explaining that. As I said too, timing of the conversation. So if someone's racing off to work, or, might be having surgery tomorrow, or is about to go and see the doctor, maybe that's not a great time to have the conversation. Maybe wait till afterwards, and then kind of the other thing I would say is check it out with the person, but that timing will really impact on these conversations. Excuse me. The other thing too is, of course, skill level and of practice. So don't expect yourself to master this all at once. If difficult conversations aren't something that you are used to doing, if they are new for you, then also be prepared that if you aren't skilled with this, you might require the support of a psychologist, of a coach, of a friend, to read some podcasts, look up Renee's stuff, to learn how to navigate this. And that's okay. So don't expect to master this all at once. And the final thing that I kind of considered would impact on this is how we do what we call rupture and repair. So rupture and repair is a term coined from Circle of Security, which is a parenting model. And what we are taught in the parenting literature with the attachment neuroscience is that as parents, we will inevitably mess up. We will, because we are human, and we will lose it, and we will get overwhelmed, and we will get dysregulated. The most important thing in the attachment relationship, but this stands for any relationship that we have, is the ability to go back and repair it. And again, this is sometimes not something that we are taught. So many people will have a conflict and are not taught how to repair the conflict, to go back in, to check in with the other person, to maybe apologize if it's appropriate, to find a way to move forward, to check the other person. Commonly, there's like avoidance or stonewalling or sweeping it under the rug. So what's going to determine how well these conversations go is our ability to rupture, which will happen, but then to work on the repair coming back. So now what I'd like to cover is some tips and tricks for you, okay, about how do we have these helpful communication patterns. So obviously the first idea is to prepare and plan. So sometimes I think what we do is we expect ourselves to think on the spot, and we expect ourselves to be able to kind of rock up to this conversation and to say what we think, and to hope it goes well. But when you are navigating difficult conversations and you're trying to learn a new skill and you're trying to do it for the first time, it is really useful if you can find some time to prepare and to plan for this conversation. So spend some time thinking about what you'd like to say. What is it that's important to you? What is it that's on its mind, or what that is on your mind? And hey, even make notes. I tell all of my clients, we all walk around with iPhones these days, right? So write down some notes in your note section or a little notepad and pen. And it is okay to go into a conversation with somebody else with your notes. And you can say to that person, I've really put some thought into this conversation and I've got my notes. And, so just, forgive me while I look at my phone or while I look at my notes, because I just really want to make sure I get all the points that I wanted to get across. The other point of preparing and planning is let the other person know. So sometimes what will happen is people will be more reactive when they are caught off guard. So in the same way, it's good for you to spend time consolidating your thoughts and feelings. It's also a really good idea to let the other person know that you're planning to have a chat with them. And you might even ask them, when is good timing? So that you give them an opportunity to potentially prepare if they can, or at least to be able to know that, okay, a difficult conversation is coming and they will mentally be able to maybe know that much. You can also invite that person to say, okay, when's a good time for you? Because maybe midweek isn't good. Maybe there's not enough time in the week. Maybe it's go to the coffee shop and have a chat on a weekend. This is something, so this second point, using I statements, this is something that's taught a lot, and a lot of people know this in the assertiveness field. So the idea with I statements is when we use an I statement, it allows us to take responsibility for how we are feeling. Many people, when they're in conflict, will be saying things like, you do this, you do that. And when we kind of place the blame directly on the other person by using that language, it can create more of a reaction in people, particularly like a defensive or deflecting reaction. So the idea with I statements is that we start with I feel anxious when you come home and you slam the door, or I feel guilty when I ask you to cook a meal for me or do the dishes because I'm feeling sick from chemo. So when we start with I feel and then we follow with when you, it's just a way of kind of softening the delivery, and it also allows us to take responsibility for our feelings, and we can describe the behavior or the situation. When we're kind of saying you, it can become a lot more sort of blaming language. And it allows us the I feel when you kind of template. It's a really easy one to remember. I feel when you, and it allows you to explain the impact that the behavior has on you. So an example of that is I feel rejected when you shut me down by saying, I'm sure it'll be fine. I need you to be more understanding and ask me questions about how I feel. So another very on trend, I guess, the psychological concept is boundaries. Everyone's talking about boundaries these days, and it is a good thing because boundaries are how we teach people how to treat us. They're a very, very, very important thing to learn how to do in life. And if you're the sort of person that is prone to self-sacrificing or subjugating your needs or putting other people first or people-pleasing, then boundaries is a very, very important thing for you to be learning. But sometimes people feel guilty for boundaries, or sometimes people feel bad for setting boundaries. And I do have some clients that say to me, oh, but it just feels selfish or it feels aggressive. I guess what I want to reinforce is that you can set boundaries with kindness and with compassion. Boundaries are an important aspect of life to teach people how to treat us. And you can do it in a way that is kind. So it is okay to tell someone what you need, or maybe what you don't need, in a calm way. You can be direct. So I think sometimes people think that assertiveness is using really soft and really gentle language, when assertiveness typically is about just being really direct with the person and not apologizing, because I think that's also another pattern that people who are prone to people pleasing can do is, oh, I'm really sorry, I'm really sorry. But I really would encourage you, if you are the sort of person, to repeat the apologies over and over again, to try not to apologize. The other really healthy way to go about this is to set limits, to say, hey, I'm not really okay with that, or I don't like it when you do that. Or when oh, I feel really uncomfortable when you do X, Y, Z. Could I ask you to not engage in that behavior, please? Maybe you wouldn't say it in that word. But the idea is that we're setting limits, not ultimatums. And I'm sure most of you know what ultimatums are, but it's if you don't, then I'm going to do X, Y, Z. So when we're setting boundaries in a kind, compassionate way, we're saying to people, hey, that's not okay with me, but we're not kind of being threatening. We're not using ultimatums, because that can feel obviously a bit manipulative for some people. So it's best not to use those. The other really important part with boundaries is you've got to hold the boundary when it's violated. So when you set a boundary, people aren't always going to hop to attention. They're not always going to say, yes, sure, okay, you set that boundary, and so therefore I'm going to adhere to that boundary. Sometimes it is going to require you to say, no, 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 remember this is the boundary. Remember this is the boundary. And you actually might have to repeat the boundary multiple times. So don't feel as though this is a one set and forget. So we do have to repeat it. So examples of boundaries are things like, can I get back to you when I have more energy? Or that doesn't work for me right now, but thank you. So that's setting a boundary with kindness. And the last thing in this little group of slides that I'd like to talk about is managing your emotional reactions. And you know what? Like, this is the hardest part, right? Where we're in these difficult conversations and we're going to be feeling the rise of our nervous system, or the activation of our nervous system, feeling particular strong emotions, anger, frustration, overwhelm, sadness, anxiety. And part of what we have to learn to be able to do is manage those emotional reactions. Now, that doesn't mean you need to be a robot and switch them off. You are going to have emotions. You are going to feel them in your body. Anger is a really strong emotion that we often just want to kind of discharge, because it feels better to kind of discharge it and get it out. And we actually have to learn to be with anger and sit with anger. So make sure that you are able to tolerate the conversation. If you need to take breaks, take breaks. Say to the other person, I need to take a time out. I want to come back to this. This is really important. I want to talk to you about this, but I'm getting really overwhelmed, or I'm getting really angry, and I don't want to react at you. So check in with yourself throughout the process. So see what's happening for you. If you can just have little pause moments when the other person's talking, or maybe when you're kind of conceptualizing or thinking about what your response is going to be. But just check in with yourself and just notice, what are your emotions? What are your physical sensations in your body? Now, this is like a little bit of mindfulness. So any of you that practice mindfulness, this is going to help you to manage your emotional reactions amazingly. But you can easily just, like, you don't have to practice mindfulness to do this. You can just have those little moments where you're pausing, you're bringing in your awareness, and then you're kind of checking in. As I said, pause and take time out. And if you do react, or you say something that you don't want to, it's okay that you apologize and that you say, look, I'm so sorry. Can we have a do-over? I want to be able to try that again. So if you do have a rupture, or if you behave in a way that actually doesn't feel good, or that you know wasn't great, come back to the person and say, I'm really sorry. I shouldn't have said that to you. I shouldn't have behaved in that way. And then ask if you can come back to the conversation with them. That is what a repair is all about. So another lovely little kind of, I guess, simple acronym to use when you're thinking about engaging these conversations is OARS. Some of you may have heard of this before. They do teach this a lot in workplace communication and counseling courses, if ever you've done it. So The O is open questions. So when you're in these conversations with people, yes, we want to get our point across. Yes, we want to be heard ourselves. And sometimes it's really important to remember to ask open conversations. And sometimes what I find is it's really useful to learn some little questions that you can have in your back pocket. Can you tell me more about that? Can you tell me what you mean? Can you give me an example of when that's happened? So asking open questions. A is affirmations. And this is where you are affirming what the person is saying. So the other person is feeling heard, they're feeling validated. And we all know what it feels like when we've got someone, validating what we're saying or affirming what we're saying. It really resonates and it feels good. So even in a difficult conversation, it's not that we're saying that we agree. It's not that we're saying that they're right. If affirmation is just saying, oh, okay, so you're affirming what it is that the person is saying. So an example is, oh, okay, I understand you don't like it when I say that, or you don't like it when I do that. Now, that's not saying that you agree with that, or that you're going to stop doing that, or that that is a maladaptive thing, but it's about affirming that person's experience. R is reflections, and that's when you're reflecting back the content of what the person is saying to you. So you might reflect back thoughts, you might reflect back feelings. So if the person's expressing something to them, you might say something like, yeah, okay, so you're feeling exhausted. So it's just giving back to them what they're saying to you. And one of the benefits of doing that is that we are then able to check out with the other person. So these skills allow the other person to sort of say, oh, no, I wasn't saying I was exhausted. I was saying I was frustrated. And you're like, oh, okay, you're frustrated. So do you mean X, Y, Z? So it's about listening to understand, not just respond. And then to summarize. So summarizing is a little bit more complicated because you're kind of bringing together what the person is saying in the conversation, and you're kind of bringing it back to them, or you're presenting it back to them. So example of this might be like, I feel exhausted all the time. Everyone wants to help, but sometimes I just want to be left alone. Then I feel guilty because they care and are trying their best, and I'm not sure what I need anymore. And your response could be something, oh, sorry. Your response could be something like, okay, let me make sure I'm hearing you right. So you're feeling worn out. And while you appreciate the care from others, there's just times when you need space. But then you feel guilty for wanting distance, even though it's what you need. It sounds like you're kind of caught between wanting connection and needing rest. That's been hard to figure out. Did I get that right? So you're checking out with the person, you're summarizing what it is they've said to you in your own words. And of course, bringing back in the lovely Brene Brown, because she's got some beautiful tips on helpful communication. So she says, practice empathy, not sympathy. So empathy is the ability to step into somebody else's shoes and imagine what that might be like, versus sympathy is when I am either feeling an emotion for somebody that is because perhaps I've been in that situation too, or perhaps I've not been in that situation, and so I'm feeling sympathy towards that person. So there is a difference. We try and lean more towards empathy, which is just kind of imagining or stepping into that person's shoes. So that is where you might say something like, I'm with you, I don't have the answers, but I'm here with you. Another tip Brene has is using this the story I'm telling myself. So if you're feeling worried about something, and if you think, oh, I don't know if this is just in my head, then you might say to people is like, the story I'm telling myself is that you don't care because you didn't ask how my appointment went. And that provides ownership over the story that you are telling and allows the other person to respond to that. Oh my gosh, no, I'm so sorry I didn't ask about your appointment. Of course I care. Or for someone to say, I'm so glad you told me that, or make sure I ask about your appointments because I do care. Lead with vulnerability, which is always Brene's thing. And that is the idea of sometimes being able to share your own vulnerability really sets a beautiful scene for the interaction and for the relationship, especially when it's with someone who struggles with vulnerability. So you might say something like, I'm scared and I don't know how to talk about it. Avoid disconnection phrases. So not saying things like, oh, at least ... At least this didn't happen. At least that didn't happen. Be grateful for this. Be grateful for that. It's not that bad. Getting curious, not defensive. So many of us do get defensive when we feel we're getting some sort of negative feedback. And we need to kind of own that and find ways to really soften that defensiveness. And Brene talks about the idea of getting curious. So find out what is happening within you. Why is it that you're getting defensive? Why is it like what's underneath that? Brene also talks about the idea that clear is kind, whereas unclear is unkind. So when we're clear with other people, that's a kind way to be. But if we're not being clear, then that can be really unkind relationally. And one of the final little models, because I'm mindful of the time, that I would like to talk to you about is a really beautiful book. If you do want some kind of guidance and help, this is Nonviolent Communication, and this is written by Marshall Rosenberg. So nonviolent communication is taught by lots of people in different workshops, and it's used by a lot of spiritual communities, and it's known as the NVC process. So this nonviolent communication actually gives you a little template that you can hold in your mind again when you are having these difficult conversations. So what we talk about is the concrete actions that we observe. So what are we seeing the person do? We're not talking about who they are. We're not talking about we're not criticizing them. We're not giving them negative labels like, oh, they're selfish or, oh, they're unsupportive. We're actually talking about what is it that we observe that they are doing that is affecting us, how we feel. So when we observe that behavior and we experience that behavior, how do we feel in relation to that? And then what do we need, value, or desire that we're not getting in that relationship? Then we go on to request that in order to enrich our lives. So it's what do we observe? What do we feel? What do we need? And what are we going to request? So you can remember those 4 little words: observe, feel, needs, and request. I'm going to give you an example. So it might go something like this. I wonder if, oh, sorry, too far the wrong way. So I wonder if now is a good time for me to talk to you about something I've been feeling. So it's a good way just to kind of check out, is now a good time? I notice that you don't offer to come to my appointments with me, and you don't ask me questions after I've been to one. So we're talking about the behavior that we are observing. This leaves me feeling alone and sad. So expressing the feeling, I need you to be more interested and involved in my care and treatment, to be more supportive. So talking about the need and then the request. So I'd like you to start attending appointments with me and talking with me about what happens in them. So that's another good like little framework, because it's not kind of getting into blaming language or any of those things that we saw in the helpful communication. It's very clear. It's a very clear way to just express feelings, needs, requests. So we're coming to the end of our time together, and it's been so lovely to spend this time with you talking about a topic that I really love and I'm very passionate about. So what I would say is, please don't be scared to play around with this. This is, I'm a psychologist. I get paid to have difficult conversations all day, every day, and I don't nail it, right? In both with my clients, even though I try my best to, but in my personal life, like we are humans. We are not perfect. So it isn't going to be something that we just kind of get automatically. And there's always going to be new triggers, new reactions, new topics. So it's always a new terrain. So please don't be scared and play with this. Let others know that you're practicing this new skill and invite them to practice with you. So if you're in relationships where you know that maybe you don't do this stuff very well, you might have a conversation with them and say, hey, I want to try this out with you. What do you think? Here's a book by Brene Brown. See this as new opportunities. So this is honestly, if I can inspire you in any way, there is so much richness by being able to dive into this vulnerability, to lean into the discomfort and really can create new opportunities and growth and deepening of relationships. Take the pressure off yourself and others. You won't get this right. Please excuse the typo. And remember, messy makes perfect, okay? Like it's progress over perfection. That it's about getting in there, giving it a go. And I've just popped my email there too. So thank you for listening to me over the last hour. I hope I've been able to offer something to you, and inspire you to, yeah, have some difficult conversations.
Thank
So
you so much.
are there any
Thank you.
questions?
There are loads of questions. First of all, I want to say, or two things. One is a lot of people joined us late, so if you missed anything, there will be a recording. So just to say, thank you everyone for coming. Two is it brought up lots of things for me. Oh my goodness, I couldn't stop thinking about my cancer journey, which was quite a long time ago, but it reminded me of many things. But we've had lots of questions and comments.
Okay.
I know we've gone past the hour, but people are still with us, and I think we should just go for as long as we can.
Sure.
So the first, and I will just go through the points. I'm not going to mention anybody's names because I find that sometimes
Sure.
people don't want to say who they are. So, but our first comment is, I have cancer and I've always just hidden away when I don't want to address something. I deal with it myself, and then when I am ready, I will talk to people. Is that wrong or bad? I've always been like this. I don't find the need to share.
No, like in terms of asking, is it wrong or bad? What I would invite you to think about is, does it impact you negatively in any way? And it will only be your own reflection and kind of self-exploration on that that will help you to identify whether or not there are any downsides for you in hiding away and dealing with it yourself. Um, so it's certainly not to say that it's wrong or bad. What I would say is that in my experience as a psychologist, that when I see people that have a tendency to want to go away and deal with their emotions themselves, it's common that in childhood, that's what they had to do. It's common that in childhood, they didn't have someone that they felt comfortable going to with this really uncomfortable stuff with emotions and thoughts and feelings. And so it's become almost a default pattern that feels really comfortable. So if that is the case, then I would encourage you to just see how it feels and just play around with what it's like for you to turn towards another person and to be able to see whether or not you can navigate this kind of new terrain of leaning into other people, to be able to support you. So I think that the fact that you said, oh, sometimes I will go away. So I know that there are some people who just like to get some clarity on things themselves first. They like to just have a little bit of processing time and then they will turn towards relationships. So I think the fact that you are turning towards relationships is really healthy. But yeah, that would be my points, is like, is there a downside to this for you at all? Is it about your childhood and you didn't have anyone to turn to when you were little? In which case I would encourage you to turn towards. But as long as you are eventually turning towards other people, that's kind of the key, because we are social creatures. We don't exist in silos, and we thrive relationally. I hope that helps.
Okay. And then I've got a comment. My husband gets very distressed when I talk about things that are
Mm.
emotional to me, so I'd rather not address things with him. How do I deal with him?
Yeah, and this is the million-dollar question. What a wonderful question. So, do you know what I would start by talking to him about your experience of what it's like. So kind of almost do what we call like a meta overview. So we're not going to necessarily go in and talk about the content of the conversation, but you might kind of sit with him and say, can I talk to you about what I notice when I discuss something that's emotional with you? And can I tell you about what that's like for me? And can I tell you about what it is that I would like to see change in our relationship? So I would encourage you to talk to him about exactly what you've just named because you named it really beautifully. Um, I think that it would then depend on how that conversation goes because we only ever have control over what we do, right? We only have control over ourselves in any interpersonal interaction with another human being. We don't have control over what other people do and say. However, we always have to start with going to that other person and saying, I love you so much. And in some ways, my needs aren't being met in these moments. And I wonder if we can talk about you finding a way to support me and meet my needs. So we always start by going to try and rectify the relationship and work with the relationship. If he was to continue to persist in not being able to make change in that area, then what I would do is I would encourage you to look who else is within your village who can meet that need. So sometimes we have partners that can't meet our needs in certain ways. And so what that would mean is if you try and it doesn't work, it's about then going to see who else is in my village that can meet the need.
Mm, mm. Um, and another point, I'm going to just keep going through
Go for it.
without, yeah, because I know people are leaving, but it is being recorded, so it's for everybody. I think these questions are very important, actually. So it's
Sure.
important to go. It says, I really wanted to talk to people about my cancer, but no one was available to listen. Not my husband, kids, or family wanted to hear. It's a statement, not a question. But is there anything that you would like to comment? And I've got another statement after that, which is quite different. So we'll do,
Yeah.
yeah.
I'm so sorry that was your, like, I just feel so much empathy. I'm so sorry that that was your experience when you're navigating such a difficult thing. If I just wonder, I guess, where my head goes to is those relationship patterns. And I'd be really curious to find out from that person, are they in, are those relationships typically that way? Are they about this person kind of giving maybe and meeting the needs of other people and other people don't reciprocate that and give back? Um, Sometimes there is a particular type of therapy that I do that's called schema therapy, and sometimes we develop certain schemas from childhood. And then those schemas, they develop from our relationship with our parents and then they replicate. And one of the main schemas that I see a lot of is what's called emotional deprivation. And so sometimes if someone has experienced emotional deprivation in childhood, sometimes we then go on to find relationships in our adult life where we are deprived because that is what we think is normal in the context of relationships. That's what our nervous system knows. So if I was seeing you for therapy, I would be encouraging you to communicate to those people in whatever way feels comfortable for you. Text, email, face-to-face conversation, phone call. And I would be saying, I really don't feel like you are there for me. At the moment, you aren't asking me questions, you're not reaching out to me. I feel very alone and I need you to be more there for me. So I would really encourage you to shape those relationships up and change them because your husband and your children, they should be supporting you and you have a right to have that and you deserve that. So I would be working to shape those relationships.
Hmm. Uh, okay, so the next point is my health professionals would not tell me what I wanted to hear. I'm very pragmatic. They wanted me to be sad, but I just wasn't. I wanted no practicalities, but they were more concerned about how I felt. This was very irritating.
I
So
love it. This
yeah,
person isn't into the warm and fuzzies.
yeah.
Yeah, I love that. And I just wonder for this person, did you communicate that to them? I just, curious. Did you say to them, like, I really appreciate the warm and fuzzies. And I appreciate that maybe you want me to be sad and grieving and showing my emotions. However, for me, what's important, my need um, is the details. I need details, I need plans, I need logic, and that's how you can support me. And I'll do the emotional
Mm.
piece at another time or in another setting.
It sort of resonates with me actually. And my breast cancer surgeon, after we'd been through everything, and I was coming for my checkups and everything was fine, he said, I did a really good job. Actually, no, it was just after he'd done the surgery. He said, I did a really good job with you because you're so scary. He said, and we ended up having a good relationship. But to begin with, I was irritated with him. So I don't, yeah. So that resonates with me a lot.
Like, give me the data.
But yeah, we had a good relationship. So I've got what do you do if someone is expressing one of the four horsemen communication patterns? Someone did this to me. Does this sound and it just makes me shut down?
Yeah.
Yeah, I think that's what they're saying. Yeah.
Yeah. So you can buy the Gutman book and give it to them. No, I'm kidding. So you would be communicating, you'd be communicating, you can use that template that we talked about at the end in nonviolent communication, because, it would depend on your relationship with the person and their ability to take this information, that you could actually say, hey, you're criticizing me and I'm not okay with that. That doesn't sit well with me. Or contempt, defensiveness, stonewalling, depends which one it is. So you could use that language to communicate that with that person if you felt they could tolerate it. Um, and if they were open to hearing about it and learning more about it. Alternatively, if you need to soften it a little bit, I always go with that nonviolent communication little template. So talk about what you observe in their behavior. So what they're saying, what they're doing, because that's just data. That's all you're doing is you're representing the data and the facts to them. Then you're going to express how that makes you feel, what your need is, and then what your request is. So I find using that template is very simple because it just takes out all of the other, I guess, language that can be sort of misinterpreted. But if someone's engaging in that, I would encourage you to find a way to communicate that to them. And that's what boundaries are about. Boundaries are about saying to people that I'm not okay when you treat me that way.
Okay. And what if you are someone who naturally rationalizes anyway, not due to stress, but it's a natural way for me? I think that must be in response to something that you said.
Yeah, hyper rationalization.
Oh, yes, yes, yes.
It would be that. Yes. Look, that is a psychological defense. I'll be so there are lots of different kind of psychological defenses that we use, but it's typically, like I think I talked about at that time, where if potentially we feel something emotionally that is uncomfortable, some of us, and I am this as well, some of us like to go to the intellectual understanding of something, because when I intellectually understand something, then I can make sense of it and I can do something about it in a way that I can't be so concrete and maybe linear about my feelings. Feelings are a little bit more messy. They're a little bit more unknown. They're a little bit more out of control. And so people who have a tendency to intellectualize or rationalize just feel more comfortable going to that kind of logic because it feels safe and it feels controllable. Now, that's not to say it's a bad thing. There are particular childhood experiences, personality, temperaments, and then also hemisphere dominance in our brains that will make people more prone to doing that than others. So there are so many factors that can go, whilst I'm talking about it as predominantly a psychological defense, there are also a lot of other factors that kind of go into that as well. I guess what I would say is it's okay that even if it is a psychological defense, it's completely okay that you have it. It's a part of you that's developed for some reason in your life that's been really useful and has helped you to survive and do well. So it's about acknowledging that, but it's when is rationalizing maybe being used as a defense. And what am I defending against? Is there something that I'm feeling underneath that is uncomfortable? Is there something else going on that I need to really work to turn towards? And as long as you're still paying attention to the emotional landscape that you have, then that's okay. It's just about, like as I said, I do that myself as well. It's where I kind of go, but I've also just got to make sure I tend to the emotional landscape that's underneath as well.
What if you're the opposite? What if in your day-to-day
Yes.
life you're always rational, but when you get really stressed, that's when you get emotional?
Well,
Because
that's
there are,
also,
yeah,
oh yes. Sorry, you go.
no, that's me.
Oh, well,
So,
I was going to
yeah.
say that I thought you meant for people that are super emotional, but
No, if you're always um uh
yeah, rational.
focused and rational,
Mm.
but when you get stressed, then is the absolute opposite of everything that you just said.
So
Um,
when we
yeah.
get stressed, when we get stressed, the tricky part is you then bring neurobiology into it, and that's that idea of the hand model of the brain. Because when you activate the nervous system, which is what happens in stress, is we have, the nervous system divided into two parts. And when it's the sympathetic part of the nervous system that gets activated, what happens is the limbic system, the emotional brain, gets activated, and that's when we go into fight flight. So we will naturally, in times of
Um,
stress, get more emotional, because it's just neurobiology.
mm.
And that's
Oh,
often why people who are prone to kind of rationalizing why they don't like emotions as much because they feel out of control. Whereas, you can't always control how you feel.
that's so interesting to know that it's biological. That's good for me to know that it's a biological thing. So I like that. So I find sometimes people see things that are not there. They think that I'm sad or being anxious, but I'm actually okay. If I say I'm okay, it sounds like I'm overcompensating. How do I deal with this?
Oh, I'm wondering whether or not these are professionals, because I do think that
What are they?
professionals
Oh, professionals. Yeah.
Professionals, yeah.
Mm.
I do definitely think that one of the things I see, and then I can think about teams where I have worked, where we do have to be careful not to overly pathologize things. And I'm very mindful of this as a psychologist, that we don't want to overly pathologize what is normal. So I'm wondering if this person's talking about those situations, because that resonates with me, and I can understand how that would sort of happened for sure. And I do think it is about, as you said, just communicating to people, well, these are my thoughts and feelings, and I am being honest. If they're interpersonal relationships, I'd be really curious as to asking feedback. So saying to people, why is it that you think that I'm not being honest? Like, why is it that you think that I am sad or I am anxious? What tells you about what I'm doing, what I'm saying, how I'm looking, that tells you I'm not telling the truth when I'm actually okay. And see what they say.
Mm. Mm. Okay, and then we have, I just don't want to upset people, like my mum.
Yeah.
When I talk about my cancer, how do I deal with this?
Yeah, I know this is a really common one. Is a lot of people don't want to upset other people, but remember, you have no control over other people's thoughts, feelings, and reactions. So, um, if other people get upset, that's okay. No harm is going to come from anyone who is sad, but we are often
Mm,
very phobic
mm,
of emotions. We're
mm,
phobic of sadness. We're phobic of boredom, of anxiety. And this is particularly, I don't know where most of your audience um, comes from, Shara, but I know being in Australia and having a lot of English and European culture passed kind of down to us, there is a lot of you keep it to yourself, you don't talk about emotions, stiff upper lip, push it down. Don't cry is something that, I hear a lot of people say to other people. There's nothing wrong with crying. There's nothing. It's a normal, healthy human emotion.
mm,
Sadness, grief, They're all normal, healthy human emotions. But in our society, we've completely lost our way with being able to tolerate both positive and negative emotions. All emotions are just emotions. I don't even really like saying positive and negative because those words are even like loaded. They're just emotions. And so if you're in a conversation with someone and that person gets sad, I'd invite you to allow that person to get sad. And if that person is anxious, allow them to be anxious. We don't have to go in and rescue people from their emotions. No harm's going to come to them. They're not going to be hurt. It's emotional discomfort. So when we're having these conversations, we have to be willing to sit in the sadness, sit in the grief, sit in the unknown, sit in the frustration with the other person. And it's going to feel really uncomfortable when you start to do this. But what I would say is, tell your mum that that's how you feel. And often when you say to somebody, part of the reason I don't talk to you about my cancer is because I don't want to upset you. Often what people will say is, but I want you to tell me, I want you to talk to me about it. Please don't hold back.
Mm,
I can cope, particularly when it's your mum, right? It's like, I can
yeah,
cope. I can cope with this. Most
yeah,
mums can.
yeah.
So we're also denying the person the opportunity to have their own feelings when they have a right to have their own feelings, but also be there for you. And your
Mm,
mum probably really wants to be there for you. She's probably very, capable of her emotions, and sadness is a normal, healthy emotion. So she will be sad, and that's okay. It's okay.
mm, mm. And our last question is, I
Mhm.
actually get anxious when somebody plans to have a meeting with me and I don't like it. Is that normal?
Yes, it can be. And as I was kind of saying it about prepare and plan, whilst I do think preparation and planning can be a good thing, don't worry to whoever that person is, me too. And so sometimes what I might say is, could you just give me I'm telling myself remember the good old Brene Brown tips. Oh, I'm telling myself a story that you're really angry with me or I've really upset you in some way. So could you just give me a little like heads up about just briefly what's this about? And then it will give that person an opportunity to say, oh, I just wanted to talk to you about whatever it is, okay? But if you do need just a little snippet, if you can't tolerate the anxiety that comes from someone saying that to you, just say to them, I'm telling myself this story, and can I just have a little sense of what you want to talk to me about? And most people will be okay with that. Say, oh gosh, yes, because it'll either be maybe not what your anxiety is telling you, or if it is actually, it was that conversation we had yesterday, then it's like, oh, okay, well, it gives you the opportunity to think about that conversation from your perspective. So it can be normal for certain temperaments, and that's okay. Just ask for a bit more information.
I love that. I'm telling myself this story.
I
It's
know.
it's so I'm gonna try and input that into my whole everything.
I
I'm
love
telling
it. I know.
myself
I
it's
love
a
it too.
yeah, just a great way to start a non-conflicting something that could be a conflicting. It's oh
Oh,
yeah, excellent.
it's
Thank
awesome.
you.
I know it's awesome
Yeah,
because well, it's not me, it's Brene. It's awesome
yeah.
because it allows you to own it. It allows
Mm,
you to own what's going on for you. And we do this in the practice that I run. We do it all the time where it's like, oh, I'm telling myself this story.
mm.
And it's amazing because most of the time the story is just a story in your
Oh,
head. It's not actually what the
mm.
other person's thinking or
And
feeling.
it gives them the opportunity to say, "Oh no, I'm sorry I
Mm,
gave you that impression. This is what I
mm.
meant." It just opened. It's lovely. Thank you.
Yeah,
I'm going to have to end on that. We've gone on
sure.
for an hour and a half, which is
Yes, sure.
fabulous. It's great, absolutely great. So let me just stop the recording, and then there'll be some housework. So thank you so much.
It's my
I
pleasure.
didn't even ask my questions, but yeah, there's
You can
loads.
email
Maybe
me.
develop. I mean, yeah, it's